Nandrolone versus Primobolan for massing. And I know with this, we're always trying to find what's that perfect combination of anabolic steroids to create the ultimate size gains. And as you search through all this and explore all the different compounds, I hate to just bring it to you that it really comes down to your total milligram amount for the most part. That drives a lot of the shift forward and growth. And how you could think about this is your total calories is really what dictates whether you're gaining weight or losing weight. And we come to the point of massing of like, well, how many calories do I need? Now, should I have more massing come from increasing my rice or my potatoes? They absolutely differentiate in the effect that they create. And some people might do better on potatoes, or some people might do better on rice. But ultimately, what still dictates the outcome is the total calories for the day. Now, it's not the quite exact analogy that we can make, but ultimately this is what it comes down to with we're looking at our total anabolic steroid milligram amount is what's really going to be the big picture item. But these compounds do differentiate, and they're going to have different outcomes as an individual and different pros and cons. And so that's what we're going to go over today is the pros and cons around Primobolan and Nandrolone for massing. And this might leave us with which one might be preferential for you as an individual in your response. And we will go down our list. The first point being is which one we're actually massing drives the most anabolism. And unfortunately, we do not have any head-to-head comparison trials of Primobolan versus Nandrolone in human subjects over X period of time that creates this clear answer of this does it more than this other compound. The best that we do have is rat studies and looking at the androgenic to androgenic ratios, Hirschberger assays, and seeing what happens in the levator anti-muscle growth when giving both Primobolan and Nandrolone. And according to this study, there was actually an insignificant difference in growth in this muscle, which it is a smooth muscle, and there's lots of limitations within that study and that research line. However, there was a slight, if you looked at the graph in this, a slight advantage towards Nandrolone. And then we also looked in anecdotal. If you just ask people that have taken Nandrolone versus taking Primobolan, they absolutely usually will say they grew more taking Nandrolone. And before we fully answer this, one other thing that we should know is a second point to make is water retention. And I think this blurs a lot of what we're getting for actual contractile muscle growth versus just scale weight increase, as there are components around Nandrolone with its interaction as a progestin. So it has some influence potentially around the progesterone receptor, but more so around the mineralocorticoid receptor and its actions around increasing aldosterone. This causing a lot of the water retention that can occur when using Nandrolone. And this aspect drives more scale weight increase, but it's water. And so keep that in mind. And when we actually have our Nandrolone come out of our system and we're left with actual, what is the contractile tissue that we actually gained, it's going to be less than what that scale weight initial increase was while we're on cycle. So if we had to pull out the water component, what are we really left with comparing Primobolan and Nandrolone for contractile tissue increases? And arguably this could be pretty close. However, off the anecdotal, we could give that one towards Nandrolone, just from all the anecdotal evidence of everyone reporting improvements in size. But that doesn't mean it's going to be the clear-cut one to always go with, because there is some negatives around Nandrolone that might not make it the best sustainable compound, or that might limit your total milligram requirement that you need to grow, which is, like I said, ultimately variable that we have to account for. So we'll give that point towards Nandrolone for being more anabolic. However, for the water retention side that we just gave, we have to give it towards Primobolan. As Primobolan, it doesn't aromatize estrogen. It also doesn't convert to DHT. It also has pretty limited interactions with other receptor sites like the progesterone receptor and influences around aldosterone. So you can have really low water retention increases with Primobolan, which has its advantages because, for one, you're going to have a clear assessment of fat gain versus actual muscle gain. Also, blood pressure increases would be less likely with Primobolan. And then also within that too is with less body weight, just as a whole, we might have better management of your health markers and also your work capacity to train. So like I said, just because something adds more scale weight doesn't mean that's going to be good in a sustainable increase. So for water retention, we have to get that point over to Primobolan. The next thing to consider is, what is the safety around the compounds? And if we looked at, well, which ones have been human approved and used in clinical usage, they both have. For different usages. Both have been trialed around anemia. Nandrolone has been used for cachexia and increasing body weight and driving nitrogen retention. We would just give an even score for both, just a tie. They're both been human approved compounds that have gone through normal toxicology testing that all drugs that go through. As far as the androgenic profile, so we talked about anabolism. What about the potential for aspects around masculinization, other androgenicity around other tissues like skin, hair, all this that could be around acne, etc. And we do have studies around using Nandrolone in females comparatively to very high doses of Primobolan in females. And Nandrolone does seem more androgenic, so more of a risk for side effects that's beyond just skeletal muscle growth. And so we have to give that point over to Primobolan. For those that are worried about gynecomastia and estrogen, this point is going to go towards Primobolan in that case, as it doesn't aromatize to estrogen. Now, Nandrolone doesn't aromatize to estradiol. However, on lab work, if you review this, it can increase your estrone levels, and it potentially might have some direct interaction with the estrogen receptor itself. And if some guys are extremely sensitive around gynecomastia when they are taking Nandrolone. This also could be around as component to drive up prolactin levels directly, which has an antagonism aspect, which also could be around its role of increasing prolactin levels, which prolactin can influence estradiol as well. And so with that being said, Nandrolone is a little bit of a messier compound as it interacts in all these different receptor sites. So we would give that point for estrogen to, and I already brought up the progesterone aspect. This interaction potentially, we look at synthetic progestins like that have been utilized. There is potential for long-term issues around brain health that should be considered. Nandrolone in research has been shown to be more neurotoxic, at least than testosterone, but potentially this is just because more so it doesn't have the estradiol component, which if you use Primobolan alone at super physiological amounts could be just as risky. So we can't really say pro or con. However, being that Nandrolone is a progestin and likely might pose a bit more risk, so we would give that point to Primobolan. Now around joints, so joint issues, people anecdotally just report that Nandrolone might have some aspect around increasing synovial fluid and just protecting the joints. And Primobolan hasn't been known for that aspect. So we would give a point over to Nandrolone for that. Other considerations too would be shot volume. This injection volume, if you're getting up to be a larger bodybuilder and require higher milligram amounts, you're gonna need to manage your amount of cc's that you are taking. And with Primobolan, going beyond 100 mg per mil can get quite difficult just from a point of post-injection pain. While with Nandrolone, if you are using the Nandrolone decanate, you could get up to 300 mg per mil and it's very well tolerated. So shot volume might be more advantageous with using Nandrolone. So a point towards Nandrolone. Another consideration for choice is farm grade. Ideally, you're choosing everything that's been in a farm grade or US farm grade ideally. And then from there, the secondary choices, which be some type of HPLC tested underground steroid, which some of these might not be accessible to you. But Nandrolone, specifically more so Nandrolone decanate in the US, is more ready available for farm grade access through just even being able to get scripts for it. So that might be a more ideal choice. There is farm grade Primobolan out there. However, it's extremely hard to access. So we would give a point towards Nandrolone for that. What about if you are going UG? We also need to consider what is going to be fake, more likely, or even underdosed, maybe even costly. That absolutely is Primobolan. Primobolan is the most commonly, I've seen it countered as boldenone. I also seen it heavily underdosed, and it can be very expensive. Hence why they want to fake it and underdose it. So it would give a point towards Nandrolone in that case. So tallying all this up, we are equaled at a tie. So really either one can be advantageous to utilize, but there's pros and cons to weigh out when you are making these choices. And like I mentioned earlier, with testosterone being a base, as this is what this context is all have to be. So we arrive at a tie between Nandrolone and Primobolan, 5 points and 5 points. So what do you choose? And so we want to put some context here, is that testosterone is always our base. And then if we want a secondary compound to drive up more milligrams, what do you choose? And there's a pro and con list to all of these compounds to go through. And what's going to be right for you might not be right for another person. And you also have to account for your own inter-individual response to this compound as far as growth goes, but more so side effects. The total milligram amount is likely driving the big picture here. However, the side effect profile within that total milligram amount can vary vastly depending on what your compound you're pairing with testosterone. And that's going to really change person to person of what you can manage well. Some people might do excellent with Nandrolone. Their health markers will look great. Blood pressure is great. Well, someone else has a terrible experience and they get gyno really easily and they do better using Primobolan. So that's where you have to explore and find yourself of weighing the pros and cons and starting at a point and then rotating compounds in to see what you do get best along with. In the next J3U PED module, I give a full pro and con list of all these compounds and how you'd go about finding what your best secondary compound would be to pair with testosterone. So if you want to learn more on these topics, join level 1. It's where I have in-depth all about our PED module. Ask me any questions you feel like down below, and I'll talk to you next time.